Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today we'll be having a Q&A on all topics for long-term care facilities. We have a panel of Quality Insights healthcare experts here today to discuss frequently asked questions, including questions submitted prior to this webinar. If you have questions to add to the conversation, you can drop those into the chat as well, or use the Q&A tool. And if you would like to speak, you can request to be unmuted by raising your hand. Before we jump in, I'd like to invite everyone to next week's webinar, which will be on multi-drug resistant organisms. That will be a rebroadcast of a webinar we held last week, followed by a live Q&A. And that will be at the same, and this webinar will be at the same time and place next Wednesday at 2 p.m. And we understand that many of you will be at the PADANA conference next week. So if you are either at last week's presentation or you will be gone next week, this would be a good webinar to invite other frontline staff at your facility to attend. And now I'd like to briefly introduce today's panelists. First, I'll introduce our quality improvement specialists. Deborah Wright is our QI specialist for East Central and Northeast Pennsylvania. Patty Austin is QI specialist for Western Pennsylvania. Penny Imes is QI specialist for North and South Central Pennsylvania. And Shirley Sullivan is QI specialist for Southeastern Pennsylvania. And Christopher Henry is the QI specialist for all of West Virginia. Also joining us is Jennifer Brown, who is our infection control preventionist, and Dr. Jean Storm, who is Quality Insights Medical Director. Welcome, everyone. To get us started, we are going to respond to some of the Q&As that we have received prior to today's call. So this questioner asked, I would like clarification on pneumococcal vaccinations. If a resident had Prevnar 13 in 2019 and then Prevnar 23 in 2020, do they now get the Prevnar 20? What is ultimately the final vaccination? If they have the 20, do we then wait 5 years and give the 20 again?
Okay, so I'm going to tackle this one, and there's always a lot of confusion around the pneumococcal vaccine schedule. So I'm going to share my screen if I can find, and I cannot. I cannot find I had the CDC website pulled up and it doesn't look like that I have it. So I'm just going to talk a little bit about, I think when you're talking about the pneumococcal conjugate vaccine 13. So this individual received the pneumococcal conjugate vaccine 13, followed by the pneumococcal polysaccharide vaccine 23. And so that's the schedule that we're supposed to give our residents, the PCV 13 followed by the polysaccharide vaccine 23. These are two different types of vaccines. They elicit immune response, but just an interesting side note, the conjugate vaccines are the ones that reduce carriage, so carrying of the pneumococcal bacteria in the respiratory tract, but the polysaccharide, that's the PPSV 23, does not do that. So experts have determined that this is the best way for our residents to receive these vaccines, the PCV first, followed by the polysaccharide vaccine. So that's the 23 second. And if you look at the numbers, those are the serotypes of the pneumococcal bacteria that are included, because there's a lot of serotypes of the bacteria. So the question is about the PCV 20. So that is once you complete your series with the PCV 13 and then with the 23, you have the option of receiving the PCV 20 5 years after that completed series. You have the option, but as the CDC shows in their guidance, that this is a discussion that should be undertaken with the provider, with the patient, to make sure that you are doing the appropriate thing for the patient. So it is the wording is not definitive. It's not everyone should get the PCV 20 after they get their completed series. That is not how the wording is. The wording is, it is a shared decision-making process. So this is a may receive. If the resident gets PCV 20, you're done. That's it, one and done. So you never get PCV 20 and then repeat that. You never do that. So we would never repeat PCV 20. And I think that's what this questioner is asking. So the answer to this question is they can get PCV 20 after that completed series if the provider feels that it is the best decision in this individual, but you would never repeat PCV 20. That is not in the guidance. Okay.
Thanks, Dr. Storm. And one person wrote in, I use the CDC Pneumorex app that will tell me what vaccine the resident is due, if any, based on what they have already had or haven't had. Super helpful. So thank you for submitting that information.
I agree. The CDC, all the tools on the CDC are, I think someone is asking. So if they had the 13, I wish I could pull up this guidance. I don't know why my screen is not allowing me to share it. It might be just because of how Zoom's working. I think, I'm sorry, Kathy, I'm reading the questions. If they have had the 13 and never received any after, so you could give the 23 or the 20. You could give either.
Dr. Storm, I just made you a co-host. Maybe that'll let you share your screen now. See if you can see it now.
No, I don't know why it's not showing. I had it in my
bottom toolbar, green button, share screen. Can you see that on yours? For me, it's in the middle.
I can, but for some reason, I don't see that CDC guidance when I.
Okay, I see what you mean. It's not pulling it.
It's not pulling it for what? Oh, wait, there it is. Now it is. Okay, here we go. That was difficult. So I think the question was if they received PCV 13 only at any age, then they can get the PCV 20 as option A. Can you see this? Option A. Yes. And then option B, they can also receive the PCV, the polysaccharide 23, either option A or option B. But you're not going to do both. You're not going to give the PCV 20 and then give the polysaccharide 23. Is that clear for the individual who asked that question? This is a really great, this is on the CDC. It was just updated recently. So it's a really great resource.
Okay, the questioner asked to repeat the site that was shared. It's the CDC Pneumorex app, and yeah. I'll post that in the chat too. Maybe I can dig up a link when I get a chance.
And the other thing we can do, just to hop in there, I know if this was just updated recently with the option A and the option B, prior it didn't have two options. So the decision tree that we used and that we have been putting out there for everyone says if they've had the 13, then a year and nothing else, a year later, you would give the 23. So now that they have this option A where everything can kind of be the PCV 20 versus determining the 23, 13, 15, all that other stuff, we will update that decision tree in the near future and get that out to everyone.
Deb, did you want me to share the link for that decision tree or hold off if we're going to be updating it soon?
I think we can hold on. I mean, it's in the last minute lowdown.
It's true. All right, and Jean, she said that was very clear, and thank you.
Okay. I'll stop sharing.
All right, I think we're ready to move on to our next question, but if anybody has follow-up questions about the pneumococcal vaccine, please drop that in the chat and we'll get back to it. So the next question is, can you explain again where to complete our annual staff influenza reporting?
Yeah, so I can take that one, and I'm just going to preface this by saying I'm going to give you a lot of information, but Kathy is going to put two links in the chat that will recap all of this and give you the trainings on where this information was gathered from. So the first thing you have to be is enrolled in NHSN, which by now I'm sure everyone is enrolled in that. If you were a facility that was previously entering the optional influenza data on a weekly basis when you did your COVID vaccine, the questions are exactly the same. It's just in a different location. So I'm going to try to verbally and hopefully you can visualize where you would find this information. But again, the slides that Kathy is going to drop in the chat shows you screenshot by screenshot of where to find this information. So when you initially log in to NHSN, on that first screen after you log in, there's a drop-down box where you would pick your facility. Above that, the first drop-down box for most of us probably say long-term care facility. If you click on that drop-down box and you also have the option of other components, so maybe it's the healthcare personnel safety component or something else that you're reporting in NHSN, you could potentially have multiple listings there. You want to look to see if you also have the healthcare personnel safety component. So you would pick that from that very first drop-down box. The second drop-down box would be your facility, and then you would be going into NHSN. So to start the conversation, we're going to pretend that you have that, and then if you don't, I'll tell you how to add that module to that drop-down box. So you'll pick the healthcare personnel safety component. And then once you do that, you would go to that left-hand side menu box that's in blue on all the screens once you're in NHSN, and you're going to go to the vaccination summary on the left-hand side menu. And from there, you're going to pick the annual vaccination flu summary. Once you do that, it's going to look just like I said, just like that weekly influenza reporting that you did with your weekly COVID vaccination reports. Now, if you didn't have that healthcare personnel safety component in that initial drop-down box, you'll need to activate that module. And we've worked with a couple facilities, and we're still trying to test all the different possibilities how you can activate this. But what we're seeing is only the facility administrator has the ability to activate additional components. And this is something different than those of us that had facility administrator rights. So how you would find who is in your system as the facility administrator is, again, from that blue menu box, you're going to look and click on the facility section. And from the facility section, first you can go all the way down to the bottom, and there'll be two roles that were signed, one the facility administrator and one for the primary contact for the building. That whoever is listed as the facility administrator in that particular question is the only person that can add or edit a component module. So you want to go in, see who that facility administrator is in there. Hopefully it's the person that's still there. Hopefully they know how to log into NHSN. And then they would, once they do that, they would, again, you would click on that facility tab in that blue menu box, and then you would click on add, edit a component, and then you would check the box next to healthcare personnel safety. Once that's done, you'll be prompted to add users and add a primary contact. And then once that's done, both of those individuals will be able to add additional users or add this role to current users. Now, if you go into that facility administrator and that person's no longer there, then you'll have to go to NHSN and request the administrator to be changed, because only that person can change that. If you need help with that, you can reach out to one of us and we'll be happy to work with you. But I do suggest that even though the annual reporting is not due until May 15th, a lot is depending on who that administrator on file in NHSN is. So I strongly recommend that even if you're not ready to input the information, at least go in and see who's that administrator and can they access NHSN and can they activate that module. Once the module's activated, then you know you'll be good. But if you can't do those pieces, that's something you want to start working on now so that you can make sure that when it gets to be May 15th, or you're ready to input your annual influenza for staff vaccination rates, you have the ability to do that. If you struggle throughout any of this, you can feel free to reach out to myself or any of the quality improvement specialists, and we can help you with that.
Okay, thanks, Deb. And I put those 2 links in the chat, and I also found the link for the CDC Pneumorex Vax Advisor app, and I put the link for that in the chat too. Our next question is, we have several residents receiving dialysis who have tunneled dialysis catheters. We know these residents are at increased risk of catheter-associated infections. Are there any additional measures we can take regarding infection control in these individuals to prevent infections?
Yeah, so I'm going to talk about this question. So the CDC has released guidance recently indicating that enhanced barrier precautions should be utilized during direct care with residents who are colonized with MDROs. We talked about MDROs last week. So you're going to utilize enhanced barrier precautions in residents who are colonized with MDROs when contact precautions do not apply. This is not the same as isolation. This is enhanced barrier precautions. And we would utilize these precautions with residents who have wounds and or indwelling medical devices. So this includes dialysis catheters. Enhanced barrier precautions mean that when staff are conducting high contact resident care activities, they're going to utilize gown and gloves. So essentially, we're going to be using gloves and a gown to prevent when they have direct care activities like toileting, bathing or showering, dressing, changing linens, changing a resident's brief, doing some dressing changes, central line changes, urinary catheter changes, feeding tube changes, trach changes. Essentially, we're going to prevent that MDRO from getting on staff's clothing, and then the staff going to the next room and then transferring that MDRO, other bacteria, to another resident. So we're going to prevent transmission of those MDROs in the facility. And this, using enhanced barrier precautions, has been shown to reduce MDRO prevalence in facilities. So that's what the CDC is recommending now.
Okay, thank you, Dr. Storm. Next question. Actually, a quick question relating to this one, a follow-up question. Does enhanced barrier precautions require signage and provider orders?
So I'm going to tackle provider orders. I would let the provider know of your assessment and for recommendations from the provider. Whether or not that requires an order from the provider, I think is really going to change from facility to facility. I would recommend that you get a provider order so the provider understands why you're doing what you're doing. And I would actually have it be just a blanket order in the facility. If you have an individual who has an MDRO colonization, if you have a resident who has an indwelling device, has a wound, that provider is on board with you utilizing enhanced barrier precautions throughout the whole facility. CDC on their website for enhanced barrier precautions does have signs that you can print out, and they suggest that you put the signs somewhere in the resident's room and also in the bathroom so staff understands that you need to utilize gown and gloves with direct care.
Thank you for your question. Next question, do nursing homes have to use QAPI tools and resources from CMS to be considered in compliance with the QAPI regulation?
This is Shirley. I can take this. No, it is not mandatory to use the CMS QAPI materials. There are tools available through many different organizations, through CMS as well as through us here at Quality Insights. You can use your EHR vendor or any resources that you find helpful in your QAPI compliance. Now, The CEMS resources, though, are a good place to start to review your QIN materials and the principles. And I do recommend that if you haven't had a chance to look at CMS's QIN at a glance, this is a great resource to help in understanding the QIN process. And it has many links to tools that you can use. And I can put a link to that in the chat. And then if you have any questions or are looking for specific tools, please reach out to one of us at Quality Insights and we'll be happy to help you.
All right, thank you, Shirley.
Mhm.
Next question says, I have heard there is an updated entrance worksheet for surveyors when they enter my building for a survey. Is there a way to get an advanced copy of this so we know what to have ready? Christopher, you're on mute.
Sorry about that. I can take this question for you. Thanks, Kathy. Yes, there is. If anyone, I know this is of interest to everybody. Everything you need for survey preparedness can be found on cms.gov. Once you go to that site, in the search box, you would put nursing home in and search for the link that says nursing homes/CMS. You can scroll down to the downloads and see a zip file of survey resources. Here you will find the updated entrance worksheet, all the critical pathways, and many other helpful tools that will help you give a successful survey. It is a study guide that's available within an appendix. I'm going to put that in the chat for those. I know that was another link, so let me just
I just put that one in the chat.
Okay, thank you.
I had that one at the ready. Okay, so let's see. Our next question is, what are the critical pathways that you mentioned, Christopher?
Those are step-by-step survey pathways that surveyors use to explore different areas and to guide them whenever they do a survey. They cover everything from abuse to dining to med pass, any kind of thing that you can think of. And an updated pathway for UTIs and catheters was just added in February, which Dr. Storm mentioned earlier. Use these to ensure your policies and procedures match the regulations. And again, it's an excellent guide to use with QIN.
And our last question, does the staffing mandate for nursing homes now include the bivalent booster?
Sorry, I apologize if you can hear my dogs. Yes, the mandate is still just for the primary series. The definition of up to date when entering information in NHSN includes the bivalent vaccine, but it's not considered a mandatory to work with long-term care.
Okay, thank you. Now we have a question in the Q&A that Jennifer already answered directly, but I'll go ahead and read it off so we can have it here for the rest of us. And if anyone else has any questions that they would like to submit for today's panel, please go ahead and send them at this time because we're starting to wrap up. Now, if I could find the Q&A because I lost it in all my windows. Zoom is not bringing it back for me.
Hi, Kathy.
It's someone else
This
here.
is
Thank
Penny.
you.
Yeah. Miss, I know I have sent an email on this, but I was wondering if with employee exemptions for the COVID vaccine, do we need to just have the signed exemption from the employee, or do we need to attach backup documentation from clergy or physicians? Jennifer, I'll let you answer that out loud, if you don't mind. Well, I know Jennifer's having issues with her voice.
Yeah, sorry guys. So I apologize. I'm a little bit under the weather today, but I just put in each facility should track and document each exemption request according to their facility policy. And when you are tracking those exemptions, make sure that you have any supporting documentation attached to that. But the most important thing with this issue is to make sure that your facility policy clearly outlines the current process for medical or religious exemptions, because when surveyors are looking, they're going to be looking more for whether or not you have an effective process for staff to request a religious exemption for a sincerely held religious belief, And, if that process is easily followed and if you're following the process that you put in place.
And I'll just add to that, as far as the medical exemptions, make sure you're following those critical element pathways, because there is a link within that list the current acceptable medical exemptions. And as someone who was recently in the facilities, we did have some staff that had medical exemptions, and the surveyors opened that link. And even though our medical exemption, we actually sent it back to this individual's provider 3 times. We had multiple clarifications. We were comfortable with the exemption, but the reason that was on the form was not an acceptable reason when you clicked on that link. So with the medical exemptions, just make sure that you're following that link and that critical element pathway to make sure that the diagnosis is one that is on the approved medical exemption list.
And Jen, Misty followed up with, so the supporting documentation is per facility and not state mandated. Is that correct?
No, you have to have it, but how you are going to be tracking your form and everything, whatever process you have in place, that is facility specific.
And I think too, what Misty is asking, because she and I have been talking about this back and forth also, is the religious exemption. That's where you really have to have your facility policy. So religious is wide open and very interpretive, but I don't know if that was the right word or not, but that's where you really have to have that facility policy of how are you going to handle a religious exemption, and then you just need to be consistent for all of your staff and follow your policy. Where the medical, you have to have that link and make sure that the diagnosis is an approved diagnosis. I hope that answers your question, Misty.
And I'll share a link to the EEOC. They have a guideline for how to help handle some of the religious documentation, to avoid any religious discrimination things. So I'll put that in the chat.
Okay, thank you. So we have another follow-up question, I think, on this topic, and then I see a hand raised, and we'll get to you next. In the chat, someone asked, is the screening of staff visitors or staff/visitors still required from CMS for COVID-19?
So I'll start, and hopefully Jen can chime in, because we've had this question frequently presented to both of us. And I don't have the numbers memorized, but I know Jennifer does. In the one PA-HON, it clearly stated that you had to have that screening. In a follow-up HON, it doesn't address it. So nowhere have Jennifer or I been able to find where it actually says you can stop. All we have are 2 different PA-HONs, one that clearly states you have to have it, and one that no longer addresses it. So, and Jennifer, I'm sure, can throw those 2 PA-HONs in the chat. That's really all we have. We do not have any supporting documentation that says you do not have to do it. We just have the HON that says you do, and the HON that was updated that no longer has that in there. So again, it's going to come down to your facility policy and you evaluating the risk for your area and the transmission in your area.
Thank you, Deb. I am going to allow James to unmute himself now to talk. So you should be able to unmute yourself to ask your question now, James. Okay, so James, I don't know if you're trying to talk, but we can't hear you. I've got another hand raised. Well, actually, no, it went away. If you don't want to talk, you can lower your hand also. Okay, hand was lowered. Maybe they didn't have a question. Maybe we covered it. So that's all the questions that we have so far, but we have another minute or two here. Before we end today's discussion, I'm going to go over some quick reminders. So if anyone else has a question they'd like to slip in before we sign off, please send them at this time. I'd again like to invite everyone to next week's webinar for multi-drug resistant organism infections if you were not able to come and watch it last week. Or invite people who you think would like that webinar that were not able to come, to invite them to attend. So that will be next Wednesday at 2 p.m. We'll rebroadcast the presentation, but Dr. Storm will be there to do a live Q&A following the webinar. I'd also like to invite everyone to join us at our virtual live chats every Tuesday and Thursday at noon. Deborah Wright will be there to answer your questions on any topics such as quality improvement initiatives, infection control, or MDS coding. You can find the links to those live chats and our webinars in the newsletter that we send out every Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on our mailing list, you can email me at ccaudell@qualityinsights.org and I will get you on the list. And I will drop my email in the chat in a moment. And I will also look to see if anyone else has any questions at this time. And it looks like there are not any. So I think we can go ahead and wrap up for today. Okay, that was just Penny says, we appreciate your participation and your questions and your feedback. Yes, thank you. Thank you everyone for all your great questions today. And I'd like to thank all of our panelists for joining us here today and thank all of you for joining us and wish you all a good day, a good week.